Listen, if you're not encouraged by my family, I have 4 medical fragile kids, and these ladies, this team of phenomenal people came in like superheroes from somewhere else. I've lived in Jacksonville since 1997, and I worked in risk management for 17 years in banking. And after 17 years, I just decided that what I was doing no longer served a purpose or added value in my life to what I was doing. So I went back to what I've known, and that was fostering children. I used to be a foster teenager. I have 24/7 nursing care with Care Options for Kids. It makes my life goes a little bit easier. Helps mom out, the nurses and the staff, between the communication, the professionalism, the compassion, warmth of these people, all of them. They're wonderful. They're fabulous, and I can't say enough what they've done for me over the past year. I get to sleep at night knowing that my kids are taken care of. I get to go to appointments and they come with me to my appointments, which is a great help. Can you imagine pushing 4 wheelchairs? I'm not a medical person myself. I actually had to learn everything quickly. My first medical foster child was Michael. When Michael first came home with me, I was scared. Here's this fragile little 4-month-old, but now he's 8 years old. He loves to say "Ma," and he loves to laugh. My next loved one that I adopted was Kenny. It was decided that he needed tracheostomy. He is thriving. He's doing much better. He smiles, he laughs. My third child that I adopted was Isaac. We call him Izzy Busy because he doesn't walk, but he can bounce his behind off that bed. I tell you, he laughs and bounces. He's extremely fragile. Thin skin, very sensitive, very easy to get pressure sores, and he has a trach now. Isaac is doing well. My last son, Jesse, came to me when he was 15. And Jesse has a lot of pediatric psychiatric issues. He can't help it. He doesn't know any better. We try to give him soft toys, nothing hard because he hits himself. Even though he wears a helmet, there's other surfaces that he can hit. And the nurses at Care Options for Kids understand my children's behaviors. They work with me, they talk with me. The communication between the entire team is phenomenal. I'm extremely busy, juggling a lot. 6 children. Well, my son is 19 now, but he has intellectual disability, and he's going to college.
My name is Mia. I'm 13 years old. I'm turning 14 this year. I really like seeing how the nurses help out, and they play a critical role, and I'm just in the back like, oh, I admire them. I want to be like them.
And my personal life happens with Care Options for Kids because my nurses are available 24/7, so I can have that social time for mother.
Since they're like taking care of the children, we can go out and like spend some time at the beach. And that's what my mom did recently. We went out to the beach a few days ago and we spent time together.
You guys are amazing, and you make my life so much better. The nurses are amazing. The staff is amazing. The clinical supervisors, when it comes to medication management, it is very vital and important that these nurses understand the complexity of the medications that my children take, from the psychotropic medication all the way to narcotics that are heavily supervised. They understand what my children need. They adhere to all the policies, not only with their job, but within my home. They make sure that the medications are readily available. They make sure that I'm readily full of medications. They're very helpful, and I appreciate Care Options for Kids, so thank you.